Okay, guys, here's your D for you. We're discussing postoperative cognitive dysfunction in elderly post-cardiac surgery patients. Progress in rehabilitation application research explores how older adults often experience declines in memory, attention, and executive function and processing speed after undergoing cardiac surgery, and how rehabilitation strategies can be applied to mitigate these effects. The surrounding page frames this as both a clinical challenge and an opportunity by embedding cognitive rehabilitation into cardiac recovery programs. Patients may regain independence, improve quality of life, and adhere more effectively to long-term cardiac care. What postoperative cognitive dysfunction is and why it matters. Definition: POCD refers to measurable cognitive decline following surgery, typically identified through neuropsychological testing weeks or months after the procedure in cardiac surgery. It is particularly prevalent and can undermine recovery. Distinction from delirium. The page emphasizes that POCD is distinct from delirium. Delirium is an acute, fluctuating disturbance of attention and awareness, while POCD is a more persistent subacute or chronic decline. Both may overlap, but POCD has longer term implications. Impact on elderly patients. Older adults are disproportionately affected due to age-related vulnerability, comorbidities, and reduced cognitive reserve. This makes rehabilitation not just beneficial but essential for maintaining independence and reducing caregiver burden. Proposed mechanism and risk factors. Mechanism. The page highlights cerebral microemboli during cardiopulmonary bypass, neuroinflammation, hypoperfusion, and silent periactive strokes as key contributors to POCD. These mechanisms disrupt neural networks and impair cognitive function. Inflammation, surgical stress, and anesthesia can trigger systematic and neuroinflammatory cascades, which are strongly linked to both delirium and POCD. Risk factors: advanced age, pre existing cognitive impairment, vascular disease, anesthesia exposure, preoperative complications, and longer bypass times are all cited as predictors of POCD. Identifying these risks. Preoperatively allows for tailored rehabilitation strategies. Rehabilitation directions embedded within cardiac recovery. Multimodal rehabilitation. The surrounding content advocates for combining physical exercise, cognitive training, and occupational therapy within cardiac rehabilitation programs. This integrated approach addresses both heart health and brain health. Exercise as therapy, aerobic, and resistance training are emphasized. As neuroprotective, improving cerebral blood flow, reducing inflammation, and supporting neuroplasticity. Cognitive training, structured exercise targeting attention, memory, and executive function, such as dual tasking or problem solving drills, are recommended to directly address POCD defects, delirium preservation. Practical measures like sleep optimization, early mobilization, hydration, sensory support, and careful medication management are highlighted as ways to reduce delirium and by extension POCD severity. Assessment, timing, and monitoring. Preoperative screening. Establishing cognitive baseline before surgery helps identify high risk patients and tailor rehabilitation plans. Postoperative monitoring. The page stresses the importance of serial cognitive assessment over weeks and months to distinguish transient delirium from long-term POCD. Functional outcomes. Rehabilitation success should be measured not only by test scores, but by real world abilities, such as medication management, adherence to cardiac rehab, and independence in daily living. Practical implementation. Takeaways. Personalization. Rehabilitation intensity should be matched to each patient's baseline cognition, comorbidities, and recovery pace. Interdisciplinary collaboration. Cardiologists, rehabilitation specialists, neuropsychologists, and nurses and occupational therapists must coordinate to embed cognitive goals into cardiac care pathways, patient and caregiver education, teaching compensatory strategies like using external memory aids, establishing routines, and pacing energy helps sustain gains outside the clinic. Research progress. While more trials are needed to define optimal rehabilitation protocols, the page underscores that existing evidence already supports integrating cognitive rehabilitation into cardiac recovery programs. Bottom line, the surrounding page presents POCD as a pressing but addressable issue in elderly post-cardiac surgery patients. By combining exercise with cognitive training and interdisciplinary care, rehabilitation can reduce cognitive decline, improve functional recovery, and enhance overall quality of life. The research trajectory is clear. Cognitive rehabilitation should no longer be seen as a optional but a vital component of cardiac rehabilitation for older adults. Okay. Okay. These two shows. Okay, guys, so that is your D for now. Gator Wellness. Take care, folks.